Hey guys, I'm Dr. Paul Garcia, and I'm the owner and the clinic director of Pacific Coast Kinesiology Center. We're a functional medicine center in Orange County, California, and what we love to do is we love to help people overcome their chronic disease, their chronic pain with natural remedies. Okay, and we've been doing a series on insulin resistance and prediabetes and weight loss resistance, and we've been talking about intermittent fasting. The last video we talked about the benefits of intermittent fasting. There's 5 major benefits. So if you haven't seen that video, go back and watch that. It's really important to understand intermittent fasting. Most people think of it maybe for weight loss, and it's wonderful. It's great for weight loss, but there's so many other benefits to it as well, from brain health to energy improvements and reversing diabetes and hormone sensitivity, and just there's a myriad of benefits to intermittent fasting. So again, go back and watch that video. Today what we're going to do is we're going to talk about the basics, like how do you intermittent fast, like actually what it is and how do you do it, and then also who should do it and maybe who shouldn't do it. Okay, so the basics of intermittent fasting, really the way that it works, the magic behind intermittent fasting is having more time between meals. Okay, so the way that we like to teach our patients, we like to have people start eating your food in an 8-hour window. Okay, so we're not talking about how much you're eating. Obviously we talk to our patients what to eat, but really that's not the important part to understand with intermittent fasting. It's when to eat. Okay, so again, we like to have people start eating their food throughout the day in an 8-hour window. So for me, maybe it's between noon and 8 o'clock at night. Okay, or maybe 11 o'clock in the morning to 7 o'clock at night. That's when you consume all your food. Okay, from 7 at night until 11 the next day, you're fasting, which is why intermittent fasting, why it's called fasting. During that time, you can have fluids, you can have water, you can have tea, you can have coffee, you can have bone broth, okay? But you don't want to add any sweeteners to that. You don't want to add anything that's going to increase insulin, okay? So there's a lot of wonderful things that happen during that fasting period. And again, go back and watch that last video and it'll talk about the benefits of it, okay? So some people can struggle. This can be hard for some people to start, because we've been told that we got to eat every 2 to 3 hours, right? You have to have 5 or 6 small meals a day to keep your metabolism going. And this is a myth. This is a big myth. It's not true. Okay, the more you eat, the more you eat, the more you eat, the more frequently you eat, the more that spikes your insulin. And it spikes your insulin, and then your insulin stays high all day long. And that's a major risk factor for poor health, is having high insulin levels during the day. Okay, so an 8-hour window is a great place to start. People will notice amazing benefits. We have our patients, if they choose to, and if they're feeling the benefits of it, and if they want to experience even more of the benefits, you can adapt to a 6 to 4 hour window as well. So it's really individualized. You can kind of, just see how it works for you and see how you feel the best, right? Okay, so the point number 2, the second point that we want to make is you want to, when you're eating, okay, so generally the way it works is you skip breakfast and then you eat lunch, around noon, and then you have dinner around 6 or 7, and that's perfect. Okay, so you're skipping breakfast, and then at lunchtime, you want to eat a full meal. Okay, you don't want to, like we've been talking in the series, you don't want to count calories. You don't want to push food away. You don't want to limit your portions at all. Okay, you want to eat until you're satisfied, until your hunger hormones are satisfied, your body feels comfortable, it feels satisfied, it feels full. And then, for dinner, same thing. You want to eat a healthy dinner until you're full, until you're satisfied. You don't want to be pushing food away. You don't want to be, limiting your portions and counting calories. Okay, really, really important to understand. Number 3 is you can ease into this. Okay, some people like to go to the beach and just run and just jump right into the ocean, and that's their personality, and it works good for them. Other people like to kind of get their feet wet, maybe go up to their knees, go up to their waist, and just kind of ease into it. And with intermittent fasting, you can do that. You don't have to jump in and say, I'm going to do this every day no matter what, come hell or high water. You can ease into it. So with our patients that have some metabolic concerns, we have them maybe start with 1 day a week, just picking 1 day a week that works for their schedule, and skip breakfast and see how you do. Okay, we always feel a little bit hungry because our body has been trained for however many years to expect food at a certain time. And so all these enzymes, our body starts making enzymes, our digestive tract starts to prepare for food. Okay, our brain starts to prepare for food. We start to expect this increase in blood sugar. And when you don't get that, it's a little bit of a shock to your system. Your body's maybe you'll feel hungry. Okay, and hungry is not the best word, because really, it's not true hunger. It's more of you've just conditioned your body to expect food at that specific time, and when you don't give it that stimulus, your body's gonna say, well, what's going on here? Okay, and so that's something that you have to work through. You have to work through that. You have to kind of decondition your body and have it expect that, okay, there's not going to be food here. That's fine. I'm going to use my stored food. I'm going to use my body fat. Okay, and that's another one of the major benefits of intermittent fasting is you become fat adapted. You start tapping into your stored food and your stored fat. Okay, and then if you're comfortable doing it 1 day a week, maybe you incorporate it 3 days a week. Okay, and so you're kind of training your metabolism. It's the other way that I'll tell my patients, it's like if you were training for a marathon, okay, you wouldn't go out and run a marathon the first day. Okay, that would be a little bit crazy, a little bit insane, right? So you start out slow, and when you're first starting out, it's a little bit uncomfortable, right? If you haven't done this before, when you start hitting the pavement, you're gonna be a little bit sore. Maybe your knees are gonna be a little bit achy, your feet might get a little bit tired. And that's just normal. So when you start intermittent fasting, there's going to be a little bit of uncomfort in the initial stage, but most people, can adapt, within, 3 days to potentially some people it might take 3 weeks to a month to really become fully adapted, fully fat adapted. Okay, so stick with it. It's really more about consistency. Is not this isn't a 1 week. We're not usually going to intermittent fast for 1 week and think that you're going to notice, major improvements in your health. You want to have it. I would say, if you want to see how it works for you, think of doing it for 3 to 6 months minimum to really kind of feel the benefits of it. Okay. So ultimately, what we want to do is we want to do it daily. Okay. We start having people do it daily, so every day. Working up to where you can do it 7 days a week. Sometimes we'll say, like a 6-1, where you do it 6 days a week, and then, 1 day is fun day. So for me, Sunday is fun day. So with our kids, we like to have breakfast, and, it's just family time, and, 1 day a week having a fun day to keep the body, so we don't get, diet variation is something that's important too. You don't want to just have the same thing every single time. You want to keep the body in a little bit of guessing pattern, a little bit of variation pattern. It's important for our metabolism. Okay, so let's talk about who shouldn't fast. Okay, I think most people, it's very safe, it's very effective, and I think it's essential for healing the body. Okay, because of the benefits that we talked about in the last video. In my opinion, for most adults, it's essential to have periods of time of fasting. Okay, but kids are still growing. Their body's still building and growing, and it's probably not the best thing to be limiting nutrients for a specific period of time with kids. So we never recommend, in most circumstances, okay, that kids fast. Pregnant and nursing women, same thing. Moms, this is not the time to be doing intermittent fasting. Okay, there's other times that I think it's very beneficial. Pre-pregnancy, it's really good to optimize hormones and to optimize fertility. So, before you get pregnant, it's a great time to intermittent fast, but then once you're pregnant, you want to nourish your body, you want to nourish your baby. Okay. Obviously if you're malnourished or if you're struggling with an eating disorder, obviously that's not going to be the time that you want to be, fasting. Okay. And then diabetes, especially diabetics who are taking insulin or taking insulin-like medication, it has to be a supervised fast. Okay, you have to be working with a doctor that can check your blood sugar. Okay, I'll tell you, diabetics need to fast. Okay, it's something that's super important, and you can actually reverse diabetes through intermittent fasting and through longer block fasts. But you have to work with a medical provider who's trained in having you to be able to monitor your blood sugar and to help you get your doses right, your doses of medication, ultimately to come off of those. Okay, so again, if you're diabetic and if you're taking blood sugar medications, please work with a doctor who understands this stuff. Okay, thanks for watching, and we'll see you on the next video.